get started. My name is Tuere Anderson, and I am the Director of Systems Integration for the Alameda County Healthcare Services Agency, and I will be your moderator for tonight's meeting. Next slide, please. Thank you so much. So we do have live translation services available this evening. So I will invite our Chinese language interpreter, our Spanish language interpreter, and our Vietnamese language interpreter to please proceed with the instructions. And then we will ask, we will ask our attendees to click into whatever language room that they need to click into. I will start with our Chinese language interpreter to share the instructions, please. Cindy, I invite you to share the instructions for how people can go into the Cantonese language room. You're muted, Cindy.
Sorry, I cannot see the instructions so far.
Great. Can you please put the instructions back up on the slide? Thank you.
Hi, 大家好，我講先定你講先啊？
我講先。
各位大家好，如果係你係講廣東話嘅話咧，我哋將會有一個嘅係廣東話頻道。咁咧，你如果係見到圖上邊有一個嘅標誌，嗰個標誌咧好似一個嘅地球咁樣樣，咁佢下低應該有俾你選擇咧呢一個嘅粵語音頻嘅，你只要點擊入去咧，你就可以進入呢個嘅係廣東話嘅頻道。一陣間咧，我哋就會講廣東話。只有你係聽到廣東話，我哋係會聽到英文，然之後翻俾你聽。
Thank you so much, Cindy. And now I invite one of our Spanish language interpreters to share the instructions.
Buenas tardes, bienvenidos al evento de esta tarde. La siguiente función tendrá interpretación al español. Para iniciar para poder escuchar en español, entre unos momentos va a poder ver un icono de un globo terráqueo en la parte inferior a la derecha de su pantalla. Seleccione ese icono y luego seleccione el idioma español. También les sugiero que escojan silenciar audio original, mute original audio, después de seleccionar español o Spanish para poder solo escuchar la parte en español. Y recuerden de mantener sus micrófonos silenciados. Gracias.
Thank you so much. And now I invite one of our Vietnamese language interpreters to share the instructions, please.
Xin chào đón quý vị tới cuộc hội thảo ngày hôm nay. Tên tôi là Tiffany và người làm việc và thông dịch viên tiếng Việt Nam, và người làm việc với tôi ngày hôm nay là cô Lan Chi. Để có thể nghe được thông dịch bằng tiếng Việt, xin quý vị nhấn vào biểu tượng giải thích, chọn tiếng Việt Nam và là ngôn ngữ mà của bạn. Để chỉ nghe âm thanh tiếng Quảng Đông, hãy nhấn vào tách âm thanh gốc và có quả địa cầu ở ngay dưới màn hình ở bên tay phải để chúng ta có thể chọn lựa được tiếng Việt Nam để mà có thể nghe được thông dịch. Cảm ơn quý vị rất là nhiều. Thank you.
Thank you so much. Maylene, can you please activate the language rooms? Wonderful. And I will request that our panelists each go into the globe under interpretation and select English. This will actually allow our language interpreters to make sure that if we are all talking too fast, they can ask us to slow down. So please, everybody, whoever needs the language rooms, please, let's transition to those rooms. Okay. Very good. Maylene, can I get the slides again? Thank you so much. Next slide, please. Okay, so just some housekeeping here. We want to make sure that all of our panelists are muted unless you are speaking. This meeting is scheduled to go from 6 p.m. to 7:30 p.m. We are honoring your time, so we will have a hard stop at 7:30. And we are currently recording. This is also streaming live on Facebook, and I believe we are having some technical issues for YouTube, but we will make sure that we get that together. A copy of these slides and the recording should be available within about 24 hours. There will be a Q&A segment at the end of this session. We have quite a few pre-populated questions, and we will absolutely do our best to answer all of any additional questions that come through. So if you are on the Zoom webinar, please make sure to put your questions in Q&A, and we may answer them live in that chat function. If you are on YouTube or Facebook, please put your questions in the chat function, and we have staff who are going to port them over into our Q&A function here. We've already talked about the live translation services available. I will remind all of our panelists to please speak slowly and clearly because it does take time to translate into our 3 languages and ASL. Next slide, please. Okay, so this is our agenda for the evening. We will have some opening remarks by leadership within Alameda County and the city of Berkeley. We'll go over some local COVID-19 data, talk about the states beyond the blueprint, focus on recovery and resilience, have space for tools and resources. And as I just stated, we will have time for questions and answers. And we are very excited to have you here tonight because it is a big deal that we are going beyond the blueprint. The County of Alameda and the state of California has done a tremendous job in our COVID response. And we want to make sure that everyone has as much information as possible about what happens at the federal level, the state level, and then our local health jurisdiction levels, and how we're all working together to continue to support the health of our communities. Next slide, please. Wonderful. So this is our panel who will be having the opening remarks today. Unfortunately, Supervisor Wilma Chan is not able to make it. She is actually in a meeting. So we have her Deputy Chief of Staff and Policy Director, Vanessa Sedano, who will be joining us for opening remarks. Colleen Chavla, the Director of the Alameda County Healthcare Services Agency, and Dr. Lisa Varhus, the Director of the City of Berkeley Health, Housing, and Community Services Department. So I would like to welcome Vanessa with her opening remarks.
Hi, thank you, Tuere. Hope you can hear me okay, and good evening, everyone. My name is Vanessa Cedeno, and the supervisor would have loved to be here to join you and welcome you tonight, but unfortunately, as was mentioned, she's still in a board meeting. But on her behalf, I really did just want to welcome everyone to tonight's Beyond the Blueprint Community Update, one of 2 that are scheduled. I'm sure there will be updates in the future from our dedicated healthcare services staff as guidance changes and conditions change. Really what I wanted to share on behalf of the supervisor is that it's here. Today is June 15th, and after 15 difficult and trying months, our state's economy reopened today. It's a huge, huge milestone. And to mark it, I know the supervisor would have wanted to express her deepest gratitude to all of our county's essential workers, some of whom you will hear from tonight, for putting their health and safety at risk to keep our county operating while also responding to an unprecedented public health emergency. And even more importantly, she would want me to thank every single one of our community members for doing their part to slow the spread of COVID-19. Thank you for wearing your masks, for practicing social distancing, avoiding large gatherings, and most importantly today, for those of you that have been able and willing to get vaccinated, thank you. It really took all of us to get to where we are today, so that as we reopen as a state, we can do so safely and minimize the risk to each other. As we reopen, I would just encourage everyone to continue to be mindful of the different comfort levels that everyone around you will have in regards to removing their masks in public, and to be kind and patient with one another as we move forward. The pandemic is of course not over, and as the Board of Supervisors and the county leadership moves forward with reopening, we set our sights on a safe and equitable recovery that supports the communities that have been most disproportionately impacted by the pandemic. We really believe that everyone in our county deserves the opportunity to live a healthy and safe life in a post-pandemic world, and we're going to work very hard every day to make that possible. So thank you and welcome.
Thank you so much, Vanessa. Really appreciate those reminders of kindness to one another. So I would like to welcome Director Chawla for some opening remarks, please.
Thank you, Tuere, and good evening, everyone, and thank you all so much for joining us tonight. Tonight, our panelists will offer guidance and answer questions as we explore what's beyond the blueprint. We've experienced many new and challenging events since early 2020, when in January, our Department Operations Center activated for a novel coronavirus. And then in March, our county activated for our Emergency Operations Center for COVID-19. It's taken many hands working many hours to fight this deadly disease. I want to take a moment to thank all of you for your efforts and sacrifices since the beginning of the pandemic. I also want to recognize our Healthcare Services Agency staff and partners, including the City of Berkeley local health jurisdiction leaders, healthcare providers, frontline workers, essential workers, community benefit organizations, and faith-based leaders, all of whom have had critical work and support done on behalf of Alameda County residents. I also want to remind our viewers that the pandemic is not over, and we pledge our continued vigilance for ongoing pandemic response to protect the health of our county's residents. Our agency is planning for the next phase of our county's pandemic recovery, and tonight you'll hear more about that plan from the Public Health Department Director, Kimi Watkins-Tartt. I look forward to continued collaboration with our community partners and stakeholders moving forward through this pandemic together. I look forward to our discussion tonight.
Thank you, Colleen. I would like to welcome now Dr. Lisa Varhus from the City of Berkeley.
Good evening, everybody. Even though the City of Berkeley is an independent public health jurisdiction, we greatly value and appreciate our partnership with Alameda County. Throughout this pandemic, we have worked diligently to coordinate together, to look at data together, to make decisions together about things such as testing and vaccination. And I just really want to honor and appreciate that partnership. I also want to thank all of those in the City of Berkeley for all that they have done over the last 15 months, beginning with, of course, our essential workforce, but also all of the people in our community that have really worked hard to do their part and to wear their masks, hold their distance. As we celebrate this new moment in this pandemic, or I guess we could call it a milestone, I also don't want to do that without forgetting that we have lost people and to keep a special place for them in our hearts. Mayor Jesse Adeguin will be holding a town hall on June the 28th at 6 o'clock. So those who are interested in very specific Berkeley information, I suggest you tune in to that as well. But we are very excited to be aligned here with the county presenting this great work tonight. Thank you.
Thank you so much, Lisa. Appreciate that. And to your point, while this is a celebration, and to Colleen's point that the pandemic is not over, I invite all of us to hold in our hearts the people who have been lost as a part of this, and the fact that it was not more folks is really due completely in part to our collective efforts in the communities, in our governments, in our CBOs. So just, we've all put in a lot of work to be where we are. Thank you. Next slide, please. Okay, so we're going to get into our panel this evening. On our panel, we have Kimi Watkins-Tartt, the director of the Alameda County Public Health Department, Dr. Nicholas Moss, the health officer for the Alameda County Healthcare Services Agency, and Dr. Lisa Hernandez, who is a health officer for the City of Berkeley Public Health Department. And I would like to invite Dr. Moss to kick us off on our slides. Welcome, Dr. Moss, and next slide, please.
Thanks, Tuere. Glad to be here. So if we could bring up this slide, thank you. So, many of us have been thinking about COVID a lot, maybe some of us more than others, but I just wanted to take the opportunity to just refresh people's memories who maybe don't think about it as much as I do. COVID-19 is a respiratory illness, and it ranges from mild to very severe or even fatal. And it mainly spreads through the air from person to person when an infected person coughs, sneezes, or talks, or even breathes heavily. Common symptoms, it can be like a flu with fevers, chills, and muscle aches, causes a cough. And when it gets more serious, it can cause shortness of breath or difficulty breathing. It can cause a loss of taste or smell. It can cause congestion, runny nose, sort of cold-like symptoms, or it might cause no symptoms at all. Regardless, it hasn't gone away, and the pandemic is not over. Even though we are here today talking about moving past some of these difficult restrictions, COVID is still out there circulating in our communities, and that's why we still have some restrictions remaining in place. Next slide, please. So this is a screenshot of our Alameda County COVID dashboard. It has lots of information about how the pandemic has impacted Alameda County, and it includes City of Berkeley data. And what you can see is that we have had together almost 90,000 COVID cases reported in the county, 3,600 of those in Berkeley and 86,000 of those in the rest of the county. And those are just the ones where people got tested. We know that COVID has affected more people than this. Not everybody gets a test. We also know that we have lost many lives in the county. Almost 1,300 people have passed away in Alameda County alone. And as you heard earlier, 600,000 people across the country have lost their lives. Next slide, please. One of the signature elements of the pandemic, not just in Alameda County, but really across the country, has been that it has not affected population, all communities equally. And we have certainly seen that here in Alameda County, where our Latino residents and Black residents experienced disproportionate impacts of COVID, even as it affected virtually all communities. And what you see here is the COVID case rate, the rates of disease transmission going back to last summer. You can see we had this very large surge in the winter where things were extremely dire in California. And since then, the situation has got much better. So it's important to see all the way there on the right-hand side of the slide, we're at very low rates now. At the same time, it's an important reminder that certain communities remain at risk, particularly those where people have to work out of the home, where many people live in a single household. And now that we have vaccine, although many of our residents are protected, we do have many residents who haven't yet had the opportunity to get vaccinated, and the risk is simply higher for them as well. Next slide, please. Now, speaking of vaccines, we also share vaccination data on our dashboard, and we have made tremendous progress, not just here in Alameda County, but really around the Bay Area. Some of the highest vaccination rates in the country, and frankly, we're doing as well as pretty much anywhere in the world, which is speaks to the effort of community members to embrace this important prevention tool, and also the effort of everyone across our healthcare delivery system and all of our community partners who've supported the vaccination effort. Almost 80% of people over age 12 in Alameda County have had at least one dose of vaccine, and 65% of them are fully vaccinated. So we really do have a lot of people with strong protection. But remember, children under 12 don't have a vaccine yet. Hopefully, there will be an emergency use authorization for these younger children in the coming months. And many adults have yet to be fully vaccinated. Next slide, please. With that, I'll turn it over to Tuere.
Thank you, Dr. Moss. And I am going to pass it to Dr. Lisa Hernandez to talk us through Beyond the Blueprint. Welcome, Dr. Hernandez.
Good evening. So I would like to speak about where we are now, which is what we're calling Beyond the Blueprint. So if I can get the next slide. So what that means is that most of the restrictions here in the state of California have been lifted. And both Alameda County and the city of Berkeley are fully aligned with the state on that lifting of the restrictions. What we will see from the state will be guidance for specific populations and settings such as childcare and schools, healthcare settings, and other settings where individuals are either immunocompromised or where the status of vaccine status is unknown, such as in shelters and congregate settings, such as correctional settings, and of course, on public transit. And we'll talk a little bit about that in a second. But everyday life will feel like it did before COVID-19 in terms of our restrictions in certain businesses and in everyday life. Workplaces and industries might have specific restrictions, either due to the business operations needs or due to Cal OSHA requirements. And Cal OSHA is the agency that institutes restrictions and requirements for workplaces and businesses for employers. So they might have employers and those work sites may have restrictions that they have to comply with due to Cal OSHA guidelines. While, as we've known, the economy has fully opened, the pandemic is still with us. We will still have cases of COVID-19. And in order to protect ourselves and protect those that aren't able to be vaccinated, as Dr. Moss mentioned, primarily children under 12, there will be masking that will be required in certain settings and situations. And we all must work together to protect those populations that are either unvaccinated or unable to be vaccinated because of health conditions. And we have to do that to continue to do our part to protect our community most at risk. Next slide, please. So what has changed? This table basically gives us a snapshot as to what we are expecting today and as we move forward. So two big restrictions have been lifted. And those are things that we've been living with for the last year plus. Those are restrictions for capacity in certain settings and physical distancing. So there are no restrictions for that in terms of any business or any setting. There's no restriction on the amount of people that can be in a setting. And again, physical distancing is not required for attendees, customers, or guests. Again, Cal OSHA will still has some restrictions for employees that employers must abide by, where there might be some restrictions for physical distancing in particular. Vaccine verification and negative testing are not required for most, are not required for most events, but there are certain settings where there will be requirements for verification of vaccine status. The one example is indoor mega events. It is recommended that verification of vaccine status or negative testing is notified or noticed for outdoor mega events. I will give a description of those two settings in a minute. When it comes to face covering and masking, we must abide by CDPH, the State Public Health Department's guidance for face coverings. And for travel, we follow the CDC travel recommendations. If we can go to the next slide and give you more detail. So this slide shows when a face covering is still required. And it's broken down by whether you're fully vaccinated or not fully vaccinated. And to be considered fully vaccinated, you must have had 2 doses of the 2-dose vaccine, or 1 dose of the 1-dose vaccine, the Janssen vaccine, and it be 2 weeks after. So for certain settings, for indoor and outdoor public settings, if you're fully vaccinated, you do not need to wear a face covering or mask. If you're not fully vaccinated inside, you must wear a mask. Outside, in most public settings or businesses, you will not need to, unless it's crowded and you cannot physically distance. There are some settings where we all must wear masks. It doesn't matter whether you're vaccinated or not. These include public transit, which includes the BART, buses, rideshare, airports, on airplanes. Other places include schools and youth settings, healthcare settings and long-term care facilities, correctional or detention facilities, and shelters, emergency or cooling shelters, or homeless shelters. In those settings, those 5 settings, you must wear a mask whether you're vaccinated or not. Next slide, please. So I mentioned mega events. Well, there's a definition for that, and it all depends on whether it's indoors or outdoors. So a mega event that is indoors is one that has 5,000 or more attendees. An outdoor mega event is an event with 10,000 or more attendees. So one example of an indoor mega event is a convention or a sporting event. And in those settings, pre-entry proof of vaccination status or negative COVID test is required of all attendees. For outdoor mega events, examples include car shows, parades, theme parks, live performances. In those events, pre-entry proof of vaccination status or a negative COVID-19 test is strongly recommended for all attendees. And when it comes to face covering guidance, the guidance that I mentioned earlier applies for those events as well. Okay, next slide. Okay, Tuere, I hand it to you.
Thank you, Dr. Hernandez. And I am going to pass it over to Kimi Watkins-Tartt, the Director of the Alameda County Public Health Department, to talk us through our recovery and resilience strategies. Welcome, Kimi.
Thank you, Tuere. Next slide, please. We've heard that right now there are more than 89,000 people or 89,000 cases of COVID in our borders here in Alameda County and over 1,200 related deaths. Black, African American, Latino and Latinx, and Pacific Islanders have experienced disproportionate disease burden throughout this pandemic. Although infection rates have declined, as we have discussed and as we have seen, the exact combination of factors needed to reverse transmission and end surges is not fully understood. Alameda County's early multi-pronged community engagement response, which centered health equity from the very start, has helped mitigate detrimental impacts seen in other places throughout the country. As all of the panelists have said, although this is a major milestone to be celebrated, we are not over. This is not over yet. And so until that time, we will continue to prevent COVID transmission and serious illness. We will continue to work to test, isolate, and support people with COVID-19. We will also work to redress COVID-19 related racial and ethnic health disparities. And last, we will use this time and the resources that have been provided to strengthen our collective public health infrastructure. And what that means is people, tools, technology, skills, policies, and practices. Next slide. This slide has a lot of words on it, and I will not be going through all of this, but we wanted to let you see some of the strategies that we are currently implementing and that we will be implementing in the months to come. This slide, along with the rest of the slides, will be available to you on our website. Instructions on where to get that information will be provided at the end. Next slide. In order for us to keep everyone safe so that we can all be safe, it's going to take all of us. Each of us has a role to play in this. Being courteous and wearing a face mask, if asked, is number one. Get vaccinated if you haven't already done so. Continue to practice good hand hygiene. Stay home if you have or if you think you may have COVID-19. Get tested if you have symptoms of COVID-19. Increase ventilation, such as natural airflow during indoor gatherings. Wear a mask if you are unvaccinated, or if you are vaccinated, as an added layer of protection. You can also sign up for CA Notify to receive exposure notifications. And last, if you are traveling, please follow the CDC travel recommendations for pre and post travel measures. Next slide. Next slide. There are some additional tools and resources that we would like to share with you. To find vaccine appointments here in Alameda County, you can sign up through Alameda County ALCOVAX. You can also visit the Berkely COVID-19 vaccine information webpage. You can book an appointment through the California Department of Public Health, My Turn. You can also check with your current healthcare provider. You could also schedule an appointment with our local large pharmacies such as CVS, Rite Aid, and Safeway. And you can also call a line that we have set up at 510-208-4VACCS, and we will help you to schedule an appointment. Last, for more information, please visit ALCO Where to Get a Vaccine. And again, all of these links will be available on the slide deck that is posted on our website at the end, or within 24 hours, I think it is. Next slide. There's additional information on here as well in terms of how you can stay informed. We provide COVID vaccine updates, which include information on eligibility and appointment information. We have a vaccine community advisory board that occurs on Tuesdays. This is a monthly meeting now at 5:30, where you can hear updates around what's happening with our vaccine efforts and participate in discussion. We also have our agency's weekly COVID-19 updates that are available on our website. We also have a workplace and recovery newsletter. And last, we also provide guidance and resources on our webpage. Next slide. There will be an additional opportunity for employers to get information about what to expect for workplaces. On June 17th at 10 a.m., Cal OSHA will review proposed revisions to the COVID-19 emergency temporary standards for workplaces. If this is approved, the revisions are expected to take effect June 28th. The governor may issue an executive order to implement this sooner, but until approved, businesses must continue to comply with current Cal OSHA regulations. Similar to the town hall that we are hosting now, we are hosting another meeting similar on Monday, June 21st from 6 to 7:30 for employers and business owners who would like to receive more information about Cal OSHA requirements. This will cover workplace safety measures and recommendations and what it means to really return to usual operations. And now I believe I will be turning this back over to my colleague, Tuere Anderson, who will open up the question and answer period. Thank you.
Great. Thank you so much, Kimi. We know that that was a lot of information. And like we said, this recording and the slide deck will be made available to you all as soon as we can, hopefully within the next 24 hours. We will be working on language interpretation of the slide deck as well. So we wanted to take this time to answer questions that were pre-submitted when folks had registered. We know that people have been asking questions in the Q&A, and some of our staff have been answering them live in the chat, in the Q&A chat. Some of the questions have not been answered yet because they will be touched upon in this Q&A session. And if not, I will, pending time, I will make sure to ask certain questions of our panelists as we have some remaining time. So we have between now and 7:20 to ask and answer questions. So I will invite all of our panelists, Dr. Moss and Dr. Hernandez and Kimi, to join us for the Q&A session. Next slide, please. Great. Okay, masks and face covering. I believe, Dr. Hernandez, this section is for you. So I will ask the first question and then have you respond. This is for the benefit of our in-language interpreters as well. So first question is, are there mask requirements to protect those who work and or live with people who are immunocompromised and or unvaccinated?
There are certain requirements in certain settings. And these settings are ones where we see individuals that are either often see people who are immunocompromised because of health conditions or medications that they are taking, or are individuals that cannot be vaccinated due to health conditions or their age. These settings include healthcare facilities, skilled nursing facilities, schools, childcare, and youth settings where they will require face coverings for those in that work or are in those settings visiting or being a participant. Other settings where masks are required include correctional facilities and public transit and public transit hubs. So those are the settings. I think some of the question might also be, if I was a parent of or a caregiver of someone who is not able to be vaccinated or is immunocompromised, are there other things I can do, or are there requirements? Well, one of the things I would recommend is that we all abide by these, which are staying home when you're sick, washing your hands, and if you are a caregiver or a parent of someone who is not able to be vaccinated, consider wearing a mask for extra protection.
Thank you, Dr. Hernandez. The next question is, can a business ask me to wear a mask or show proof of vaccination?
Businesses can ask those questions, and it is not a violation of any privacy laws or HIPAA requirements if they're asking those questions.
Thank you. And the last pre-populated question in this section is, when can we completely eliminate wearing masks and face coverings?
That is $1 million question. At this point, we are not there yet. We have to see transmission of the disease go down more, and more people vaccinated. And my suspicion is that we will continue to require masks in certain settings.
Great. Thank you so much, Dr. Hernandez. Next slide, please. Great, thank you. So these are vaccination questions that were pre-submitted. Dr. Moss, I'm going to ask you to answer these questions. The first one is, can public places require people be vaccinated before entering? And if so, how will that be regulated and monitored?
Well, the most important vaccine requirement is the most important requirement is the mask requirement for those who are not vaccinated. So that's really going to be the most important requirement from a public health standpoint. Vaccination is required, either vaccination or testing is required under the mega events policy that the state has put out. So there are some limited vaccination requirements in this new state beyond the blueprint guidance. And individual businesses may be able to do this. in terms of regulation and monitoring for the mega events, indoor events where the state has required either evidence of vaccination or evidence of testing. It's up to the organizers to implement and monitor that. It is not done by the public health department or the state health department. So it's really going to be where it is required up to the individual businesses. In general, again, the most important thing is going to be mask requirements for unvaccinated people.
Thank you, Dr. Moss. Next question. Some people can't get vaccinated due to medical reasons or young age. How do we keep these people safe?
Well, the most important things for keeping people safe in our lives and in our communities is to get vaccinated. That will help limit the spread of COVID and limit its impact on communities and protect each vaccinated person. And then face coverings for unvaccinated people will also protect those who can't get vaccinated. And that's why face coverings are still required indoors for unvaccinated people. And of course, staying home when sick, that's a really important thing that we can all do to protect others in the community and limit the spread of COVID. So those are really some of the most important tools that are available to us. Hopefully soon, we'll have a vaccine for younger people.
Thank you. Next question is, will unvaccinated people spreading the Delta variant create a vaccine-resistant variant?
Variants emerge all the time. They're a natural part of this virus and other viruses. When one of the reasons that as more and more people in the United States get vaccinated, it's important for us to support vaccinations around the world is so that the virus just has fewer opportunities to adapt. And so I think that's really what this question is getting at, and it speaks to the importance of public health as an issue that's beyond just our immediate communities. And then certainly one of the reasons that we want to get as many people vaccinated as possible is just so that there are fewer unvaccinated people who might get COVID and might pass it on to others. And that's not really a variance issue. I would think of that more broadly. That's just a COVID issue. All these variants they're still COVID, and they may differ in some certain aspects, but they're all really just COVID. And the important thing is that we have good tools to limit the spread. Those continue to work, and we need to use those.
Thank you very much. The last question in this section is, if a person has COVID antibodies, why must they get the vaccine?
Well, so people who have had COVID probably do have some immunity to getting reinfected. Reinfection can happen, but it seems like most people who were infected will be immune for some time, for some months, and it's still early. We don't know how long that lasts. But we do know that the vaccine creates a very strong immune response. And although it's early, it appears that that immune response is actually stronger on average. And that's why people who have previously had COVID are still recommended to get the vaccine. Now, the other thing is it's just tricky to get everybody tested for antibodies and to know exactly how much antibodies on a test means that a person won't get COVID versus maybe still needing to get a vaccine. And so for that reason, the policy really has been everybody should get vaccinated regardless of whether or not they've had COVID.
Thank you, Dr. Moss. And I just want to direct you to the Q&A because there are a couple of questions about vaccine that I think you could probably answer in the Q&A. For now, we will go on to the next slide. Thank you so much. And Dr. Hernandez, I believe you're up to talk through activities and events. The first question is, are there restrictions around singing, exercising, or playing instruments?
Generally, there are no restrictions. There are recommendations, however, especially for singing and playing wind instruments. There's a recommendation for additional distancing, but it's not a restriction or requirement. So basically, what we're asking is for people to use their best judgment, and also the same recommendations that we have for individuals in any setting applies here. If you're sick, do not participate in any activity or go to the gym if you're exercising, or perform, whether it's singing or playing any instrument, because there's a chance that it could be COVID or any other infection that could be transmitted to other individuals. We also want people, again, to continue to have good hand hygiene and covering their coughs when they cough or sneeze. So those are the recommendations. The other recommendation is to increase ventilation, and that's for any setting, but especially in a setting where people are singing or playing wind instruments. We want to have increased natural airflow, especially in those for ventilation in those settings.
Thank you, Dr. Hernandez. The next question, and there were several questions in our Q&A chat on this topic. What are the restrictions for pools, fitness facilities, and communal sporting areas? For example, tennis, racquetball, or basketball courts, at gyms and fitness centers, residential developments, sports complexes, etc. What are the restrictions in these places?
There are no restrictions that are being applied by the state or city or county public health. Again, these settings can have, if it's a HOA or a specific club or business, they can place certain restrictions in those settings, but there are no restrictions that the state public health or the county or city public health is going to impose in those settings. I will say that there are going to be requirements for workers because of the Cal OSHA restrictions that may be applied for the workers of those certain settings, whether it's a club or a gym.
Great. Next question. What kind of restrictions can be expected at large free events open to the public, such as Oakland First Fridays?
So Oakland First Fridays, I believe, falls into the category of a outdoor mega event. So there's a recommendation there for testing and or a pre-entry verification of vaccination status, but that is a recommendation. And whether it's this event or any other events, the host of those events have the option to, when it's an outdoor mega event, the option to check for vaccination status or for testing. And that can be in different ways. It can be the honor system where people self-attest, or they can actually verify the status. The masking guidelines are need to be adhered to. So if you are vaccinated and it's outdoors, you don't need to wear a mask. If you are unvaccinated, you will if you cannot physically distance.
Thank you. And the last question in this section, Dr. Hernandez, is can businesses still conduct temperature checks on me before entry?
While it is not required by the state or county or city public health, businesses can be more restrictive and continue to conduct those checks.
Thank you. Moving on to our next section. Next slide, please, Maylene. Great, general safety. Dr. Moss, I'm going to ask you to answer these questions, please. The first question is, how safe is it for people with chronic conditions, for example, HIV, pulmonary disease, etc., to now use public transportation?
Well, most people with chronic conditions can get vaccinated. Virtually anybody with chronic conditions can get vaccinated, and most of them are going to get good protection from the vaccine. So that's one thing that's very important. And also, masks are still required for not just unvaccinated people, but everybody on public transportation. And so that adds an additional level of protection in those settings. So I strongly recommend that people get vaccinated, but also the masks will help make public transportation safer. And right now, there's simply not a lot of COVID circulating in our communities. It's still here, and we still see cases, but the risk is lower than it was earlier in the pandemic. And it may come back in the colder months. That's a possibility, but for right now, there's not a lot of COVID around. So that also makes it safe. So I do encourage people to get vaccinated and to use public transportation if that's what they need to do to get around.
Thank you, Dr. Moss. The next question is, how safe is it for pregnant women to be in a room with other people who are vaccinated? Are N95 masks recommended for pregnant women?
Pregnant women would be very safe to be in a room with other people who are vaccinated. Certainly pregnancy, like certain other health conditions, can confer risk of worse COVID outcomes than in non-pregnant people. And so it's important for women who are pregnant or considering getting pregnant to get vaccinated. And we're getting more and more data to show that that's safe. And I expect we'll learn even more in the coming months. But also it's one of the reasons why we do require masks for unvaccinated people in indoor settings is just so we can protect people who are pregnant or may have other conditions that put them at elevated risk of COVID. N95 masks are not specifically recommended for pregnant women. Certainly people who are familiar with their use and have a fitted mask that they're comfortable wearing, N95s need to be fitted to work properly. They can use that, but they are generally, they are not recommended. Regular face coverings are required for unvaccinated people. And vaccinated people don't need to use a face covering.
Thank you, Dr. Moss. Next question is it safe to visit elderly people in assisted living as I did before COVID?
It is safe if the safety rules are followed, and there are still rules for people in assisted living and nursing facilities that the state has published, and but they're less restrictive than they were. We do want people visiting families and others in those facilities. So make sure you follow the rules. You can ask what they are in advance. and please go visit those people. They definitely want to see you.
Yeah, thank you so much, Dr. Moss. Last question in this section is, what steps will be taken to ensure that there is not another surge once restrictions are lifted?
Well, the most important thing is we are working hard to continue to create opportunities for people to get vaccinated across the county, and particularly in our hard-hit communities. And even though the restrictions are relaxing statewide and rates are low, that work continues. That's going to be the most important thing. Again, the ongoing mask requirement for unvaccinated people will contribute. We continue to have an isolation requirement for people with COVID. We continue to do case investigation and contact tracing and outbreak investigation. So certainly a lot of things continue to try to limit the impact of COVID on our communities, even as these very broad restrictions are lifted. And we just have to make sure that we're watching carefully and understanding what's going on with the health of our communities, really continuing bread and butter public health. And we are doing that.
Thank you, Dr. Moss. I am going to invite Dr. Lisa Hernandez as well as Lisa Erickson for the next section. Next slide, please. I will introduce Lisa Erickson. She has been our children and youth in congregate settings lead for our COVID-19 response. She has been fast and furiously answering questions in the chat. And I want to give Lisa Erickson a chance to answer some questions that had come up in the chat. So Lisa E., I will ask you to get started, and then just with a general overview quickly, and then I will ask Dr. Hernandez these questions. Please go ahead, Lisa Erickson.
Okay, thanks, Tuere. Good evening, everybody. So there were lots of mask questions in the chat about youth settings, schools, summer camps, and childcare. So I thought I would just clarify for everyone. And there's a couple of resources we can share as well from the state that will help. But so indoor in all of these youth settings, which includes youth sports, summer camps, childcare, schools, indoors, masks are still required. Outdoors, masks are not required. However, I do want to mention that the CDC still recommends that unvaccinated people wear masks outdoors in crowded, when it's an outdoor crowded situation, or when they're doing like high contact sports, something like football, they would still recommend wearing a mask. But, and then also indoor sports, I want to just point that out too. In indoor sports, you still need to wear a mask for youth sports. So that was the mask questions. And then I think there were lots of other questions, but I'm going to let Lisa Hernandez answer these two because the other questions I was answering before, I think, relate to these two questions.
Thank you so much, Lisa.
Sure.
All right, Dr. Hernandez, the first question is, will there continue to be masking and physical distance requirements at schools?
So as Lisa Erickson mentioned, there will be, there's continues to be masking requirements in school settings. And Lisa Erickson pretty much outlined those situations. In terms of physical distancing requirements at this time, there's a recommendation for physical distancing when practicable, which means to try to maintain the physical distancing if possible. But in certain settings, physical distancing may not, or situations, physical distancing might not be possible, especially when you're dealing with younger children. So again, that is a recommendation, not a requirement. We do hope to see some updates on the guidance from the state once CDC updates those guidances, but we're not sure when that will happen. So at this point, these are the requirements and recommendations for schools. And if Lisa Erickson wants to add anything, I invite her to clarify or correct.
Actually, for the physical distancing within the classroom, schools still need to follow the school reopening guidance until that guidance is updated. Currently, right now, the classroom requirement is still 3 to 6 feet for inside a classroom. So I just wanted to point that out. And like Lisa said, we are anxiously awaiting this guidance. And when we receive this guidance, we're going to do our best to get this information out to all these settings. And we have several meetings that we do and webinars. So we'll do our best to get the information out once we receive it. Thanks.
Thank you, Lisa and Lisa. Next question, sort of similar, and I feel like it's mostly been answered, but I will still ask it, which is, will after school programs, youth sports, summer camps, daycares, and preschools have the same requirements as schools?
So most of those settings are aligned with schools. However, licensed childcare and some preschools have their own requirements because of the licensing agency that governs them. So those institutions know who they are, but most licensed childcare and preschools that are not affiliated with schools in particular have different requirements. And essentially those are a bit stricter when it comes to cleaning and especially for shared toys or devices or equipment that is used. So that's where there are increased requirements for those settings. And also the same in terms of groups and keeping stable children. The setting in terms of the size of those preschools or child care settings are governed by the licensing board, and it's not determined by public health guidelines. Lisa Erickson, please add if I should clarify other things in terms of masking. That is required across the board, regardless of who the licensing agency is.
Lisa E., before you start, I'm going to ask the ASL interpreters to switch, please. Pamela, you can switch out for Janice. Thank you. Okay, go ahead, Lisa Erickson.
Yeah, so we're also waiting, as I just mentioned before, for all the guidance to come out for youth settings. They're working on it right now. I think they're actually waiting for the CDC to release their guidance first, which makes sense. And then the state will be able to release the state guidance. What Lisa mentioned about childcare is that childcare is governed by community care, the community care licensing division. And so they do have different requirements than schools. But as far as, public health, we're not sure if it's going to be one kind of document or, for many youth settings, or if it will be separate. It will probably be separate. There'll probably be something for schools and maybe something separate for childcare and camps. So still waiting on that. But yeah, I think for the moment, just wanted to reemphasize that for summer camps and daycare and schools, you need to continue to follow the current public health guidance. So nothing has changed at the moment. And then for schools, they did actually update their guidance to include the new face covering guidance. So, which says that that people don't have to wear the masks outside, but they have to continue to wear them indoors. I think that hopefully that clarifies things. Thanks.
Thank you, Lisa E. and Lisa H. That is the end of our questions on the slides. I am actually going to look in our Q&A. Thank you to all of our folks behind the scenes answering these Q&A questions. You can remain on the other slide for now. And actually, if you can transition, Maylene, to the panelist view, that would be helpful so that we can call on our panelists. So this first question, it says, I am concerned about home care agencies that often serve vulnerable elderly populations. Shouldn't face masks be required for these agencies? Dr. Moss or Dr. Hernandez, do you want to answer this question?
So I'm guessing the home care agencies are considered healthcare providers. And if that's the setting or the type of care that they're providing, those individuals will have to adhere to the standards of healthcare settings where masks will be required in those settings.
Thank you so much, Dr. Hernandez. Dr. Moss, is there anything you would like to add?
Yeah, and I would just say that the state mask guidance does, the guidance document doesn't speak specifically to that, but does speak to the need for face coverings for people who are working with certain, higher risk populations. So that would include home health care in a lot of situations.
Thank you very much. A next question is, if we rent a hotel ballroom for an event and the hotel does not require masks for vaccinated guests, can we still require masks to be worn and temperature checks to be taken, even though the hotel will not?
I can take that one, Dr. Moss, and you can back me up. That is allowed. You are acting as the host of that event. And as the host of that event, you can make stricter requirements than what the hotel has set. So as the host, you can make those requirements, and then you are responsible for ensuring that that your attendees comply to those standards that you set.
Great. Thank you, Dr. Hernandez. I am going to invite Lisa Erickson back in to clarify something around classroom distancing requirements. Lisa, can you turn on your camera so we can see you?
Sure. Hi, everybody.
Thank you.
Sorry, I made a mistake, so I wanted to clarify my mistake. For the classroom distancing that I mentioned earlier, CDPH, it's a strong recommendation that kids are spaced between 3 to 6 feet, but it's not a requirement. So sorry about that. I got that wrong. Thanks.
There is, stay on, Lisa E. There is another sports question just to try to clear it up. Do adult coaches and officials need to wear masks when participating in outdoor youth sports of moderate contact or less?
According to the recent CDPH mask guidance, no, they would not need to wear masks outdoors. However, yeah, that's all. That's what I'll say for that.
Great. Thank you so much, Lisa E. So let's see. Another question is, will restrictions continue when serving food? During the past year, restaurants have dispensed food individually packaged. Beyond restaurants, can we now return to sharing or handling individual food, ladling individual food dishes, for example, at salad bars or in potluck situations?
I'll start, and Dr. Hernandez, welcome to jump in. So COVID is mainly spread in droplets or aerosols in the air. It may, in rare situations, be spread because you've got virus on your hands that had just recently been come from somebody's respiratory tract, and maybe you put your hands in your eye or your nose. but it really does seem to be mainly through the air. And so that means that most of these kinds of things are no longer restricted, salad bars, drink dispensers, things like that. But for COVID, and really, I think it's just good health practice. Wash your hands after you prepare your meal. You get back, you have your plate, or you've got your food. Wash your hands before you eat. You can wash your hands afterwards. That can help protect other people, and that's really the most important thing to do, and that'll help for any COVID risk there is from that, dirty soup ladle, but it also protect against colds and flu and that sort of thing.
Thank you, Dr. Moss. I just want to remind folks that we will be doing a deeper dive on next Monday, the 21st, from 6 to 7:30 p.m. for employers. So not all of the employer questions were answered here this evening. So please do plan to join that if you can for more detailed conversation around employers. Okay, another question is, can it be required for children to have a vaccine once it's available to attend school?
Other vaccines have been required for school children. It's typically done by the state, and it is a possibility that it could happen for COVID. It is unlikely to happen for this school year. We don't have a vaccine yet for the youngest kids, even if we might get that by the fall. It's I think very unlikely to happen quickly. So we'll see what happens for subsequent school years. And we'll look to the state to take the lead on that kind of policy.
Thank you. Another question, a follow-up to going back to the question about renting a ballroom in a hotel. If the hotel has standards of wearing a mask, checking temps, etc., can the host of the event renting the ballroom override the restrictions the hotel has set? So what it sounds to me is the opposite. If the hotel is being more restrictive around wearing masks, temp checks, can the host of the event say, we don't want that?
I can answer generally. I cannot speak to what each business or hotel would do. But my expectation is that those standards are there for a reason and are not and would be applied uniformly or universally for that hotel. And I do not believe there would be an option to be least restrictive. However, that is a conversation that the host should have with that specific business. But I would anticipate that those requirements are there for a reason and would apply in all settings throughout that business.
Thank you, Dr. Hernandez. I'm seeing more questions come into the chat. I think I will extend it for a few minutes longer. Some of the questions have already been answered. So if we don't get to your question today, that is possibly why, because they have been answered previously, either in the chat or by our panelists. There is a question, which is, how realistic are we to expect everyone to follow the honor system and mask up when they're unvaccinated?
Well, I think it's honestly, it's hard to know. I think mask use has been very high in the region already, and so we're starting off from a place of very, very widespread mask use. And the other thing is that vaccination rates are very high, and so we're really talking about a relatively small proportion of people who might choose to ignore or take advantage of a self-attestation or honor system and not wear a mask. Now that may be different in some communities. There may be areas where there are where there's more of that. Generally, I think that the risk of that is relatively low. That's why the state felt confident making that an option. But businesses and organizations that for whom it's best for their customers and staff to require masks for everybody who comes in can do that, and I think that's a reasonable option. And everybody should bring a mask with them regardless, because you may be asked to wear it.
Great, thank you so much. I have another question. It's my understanding the 1918 pandemic lasted for 2 years. How long do you expect this pandemic to last?
That's another $1 million question. I see that we're at a good point here in terms of community transmission here in the Bay Area, especially, and in California as well. We're looking better than we have in a long time. However, as we've been saying throughout this presentation, the pandemic is not over yet. And a lot of that has to do with not only our own communities, but communities worldwide. We are only a bus ride, an airplane ride away from settings where vaccine acceptance may be less than here in the Bay Area, or that there's not the same level of access to vaccine. So at this point, we've been in this pandemic for a year and a half, essentially. So 2 years is not an unrealistic time frame, even for this pandemic. So we'll see. I think it'll be 2 years for all, and maybe even longer.
Thank you, Dr. Erickson, or Dr. Erickson. Sorry, I was reading Lisa's name. Dr. Hernandez. I just promoted Lisa Erickson, who is the School Health Services Administrator within the Center for Healthy Schools and Communities. And she has been our lead for children and youth in congregate settings. That was a question that I'm answering live. I'm going to take probably one more question. And I'm going to see if I can interpret this correctly. When we speak of the public as private owners in condos, if we restrict and allow no guests in the condos, are we still considered public? So I'm not sure, Dr. Moss or Dr. Hernandez, if you understood that question.
I think if the question gets at where the state face covering restrictions apply, what constitutes a setting where that is required, I'm afraid I'm not sure I caught exactly what the setting would be, but if it's a it's a private home, it wouldn't necessarily apply. Although really any time that there's a gathering of a lot of people, you don't know the vaccine status of who's in the space. I think that in that situation, it's prudent for unvaccinated people to be masked.
Great. Thank you so much. Okay, so it is almost time for us to close. I will ask Maylene for you to put up the slides, our very last slide. And before I close us out, I would like to invite all three of our panelists, Dr. Moss, Dr. Hernandez, and Kimi Watkins-Tartt, to send us off with some final words in the next few minutes. I would like to start with you, Dr. Moss.
Well, I wanted to echo what Vanessa Cedeno said on behalf of Supervisor Chan. We are extremely grateful for the sacrifices and efforts of all of our community members, businesses, everyone across the county who really, did their best to make things work during what was a very challenging time. And I'm hopeful that those days, those most difficult days, are behind us. But it really, it was really the shoulders of community members that the burden fell, and so we are very grateful for what people have done.
Thank you, Dr. Moss. Dr. Hernandez?
I too want to thank the community for their overall compliance and understanding of the need to keep each other safe and healthy. We are here today because of the collective efforts of our community, and I thank the community for that. I also want to thank the community for the support of us here, those folks that are working at the city and county level to help others be safe, and to I'll speak for myself, and I'm sure Dr. Moss, we thank you for the support of the work that we had to do as public health officials during this time. And I also want to thank the leadership of both city and county and state also for providing that support, so we could protect the community in the way that was science-based and also able to use evidence and equity focused approach to protecting our community.
Thank you, Dr. Hernandez. And I would like to end with you, Kimi.
Of course, I would like to echo the sentiments of both Drs. Moss and Hernandez, thanking everyone for all their work and their support. And I'd like to ask us, as we walk away from this webinar tonight, with many of the restrictions having been lifted, that now that those things won't be present as much as they have been over the past 15 months or so, it's now on us. It's now about how we want to live, how healthy we want to be, what we're willing to do for each other to have a safe and healthy Alameda County. And I believe that we can do this together.
Thank you, Kimi. And I would like to take this time as we close out to thank all of you who have attended, who are watching live on Facebook or YouTube, who submitted questions and who really participated to make this such a rich discussion. This is why we do this work. So we're very grateful for all of you here. I would like to thank our panelists for all of your hard work and thoughtfulness in answering the questions. I would also like to thank our interpreters and asking us to slow down. It takes a village, and so we really want to make sure that everybody is getting this important information. I would like to thank the teams behind the scenes answering questions on Facebook and YouTube and here in the Q&A. And to let folks know, you can see the contact information here on the slide. We will be posting this video on our YouTube channel at Dare to Be Well. You can see the little @ here in the bottom left-hand corner on the yellow bar. And we will be posting the slides on our recovery page on our website, on the COVID-19 website. And will take some time for us to get the slides translated, so the English slides will be posted first. And we are so grateful that all of you took your time this evening to be with us. And we hope that you continue to stay healthy and take care of yourselves and one another, and just continue to be well. And so with that, we will end this community update. Thank you so much, and take good care, everybody.